My name is Christy Tice, and I'm one of the medical geneticists here at Stanford and a member of the MCHRI Educational Committee. And I am excited today to present with you some great talkers on the principles of community engaged research. We're going to have a presentation by Anisha Patel, who's professor of pediatrics and director of community engaged research at MCHRI, along with Janine Bruce, senior research scholar in the Office of Child Health Equity and director of scholarly concentration in community health. But before we get started, a quick thank you to the MCHRI Education Committee for putting these seminar series together, and a big thank you to all of you who are joining today. And then just a shout out for October 19th of this year, we'll be having our 6th annual MCHRI Symposium for the Maternal and Child Health Research Institute. The keynote session will be on climate-induced change in maternal and child health, and we'll have guest speakers from around the country, including Erin Bernstein, who is at the National Center for Environmental Health Agency and Center for Disease Control and Prevention, Erin Bendavid, Associate Professor of Medicine, Primary Care and Population Health at Stanford, and Thomas Lubin, a senior epidemiologist in the Center for Public Health and Environmental Assessment. So I think these will be really great talks, along with the agenda for the entire symposium, which we've been working hard on, and I think will be of interest to many people in the audience. One other thing to mention is just our upcoming MCHRI seminar that will be Monday, October 2nd at 12 to 1. Again, it will be a hybrid event. And the title for that will be Demystifying Implementation Science, and be given by Mark Govern, a professor in the Department of Psychiatry and Medicine. So without further ado, let me introduce today's speakers and just give a big thank you for being here. Thank you so much for that introduction. All right, so we're going to go ahead and get started. Thank you all who are here in the room and virtually. We will try our best to keep up with what's going on in the chat, but I'm excited to present today with Janine Bruce, who you'll hear for in a moment. But we are excited about the launch of the new Office of Community Engaged Research, which many of you have probably heard of in a couple presentations, but if not, just wanted to say that Mary Chen in the back there is also helping us with these efforts, as well as Don Maytan, who's sitting here also. So would love those of you who are here in person, you could come up later and chat with us more about that. And then Janine is the director of the Office of Child Health Equity, which is another great resource within the Department of Pediatrics, but also works very intricately with other groups on campus working on community research. Okay, so we're gonna get started. So our learning objectives today are really to talk about why this approach is actually important in reducing health inequities. It's coming up a lot in grant applications. You may be seeing increasingly emphasized. So just want to go over kind of what it means and what are some of the ways you can go about integrating these strategies in your own research. And also want to share some resources that are available for you on this topic here at Stanford, not only in MCHRI, but also more broadly. And then we will have about 10 minutes or so just for you all to share any experiences that you have had or any tips you have for us, because I think all of us who are engaging in this work have learned many lessons over the years, and depending on what your partnership is like, you may have had different lessons that you've learned through your own work. So what is community engaged research? So it really is trying to work with the individuals who you want to impact with your research. I think we're all doing research to hopefully impact child and maternal health. And so how can we involve those who we're trying to impact in actually thinking about how we co-design the research together with them? And that's all the way from thinking about how we define the research question to implementing the research, even developing study design. And for me, the most exciting part is actually the dissemination, which you'll hear about some examples today, but really being able to work with those community partners and patient partners to disseminate the research so it can actually have wider impact than that PubMed article. And there is a spectrum, as you see here. So there's community education, which I think at a minimum as researchers, we should be engaging in this. So this is just taking your results when you finish a study, putting it in an infographic or some easily digestible way that patients or participants could understand, or a visual abstract actually is becoming more common with journals. And then disseminating that back to the study participants so they can see how they actually participated is advancing science. Because we also often hear from participants that they want to know what happened to that study that I participated in, right? So that's like the very minimum. Then you can see there's also community focused and community based research. So research that's taking part in community settings and is trying to address a knowledge gap in the community. And then there's community based participatory research, which is true engagement throughout the research process. And so why is this important? So one is that it can increase the relevance of the research. So when you are working with patients or communities or policymakers to design your research question, it is going to be important because they know best what is the topic that and what is the research that's actually needed to advance practices, right? And to improve their health. And so that's one topic that I think is really important with regard to this, is just how it increases the salience of the research topic. It also helps you to tailor the research to the local context and the culture. So something that we design here in the Bay Area, for example, may not be applicable in a global health setting. So working with the partners on the ground, make sure that your interventions or your programming or even your survey instrument is really tailored. Also helps to improve rigor. So one example I have from my own research is we work with community partners a lot of times to co-design our survey instruments. And by doing that, we make sure that the survey instrument is actually understandable to the community. So at a literacy level that makes sense. Also able to incorporate examples from that specific community. So I work on beverage access. We a lot of times will include culturally relevant beverage options, right, in our survey because of their input. Also can help to improve response rate and retention. So when you're working with partners and they are involved in the recruitment and the retention of study participants, you're going to get higher rates because they trust those partners that are with them in the community. They may not trust me, Anisha Patel at Stanford University, right? Because they don't know me. So that is another key benefit. And lastly, as I alluded to, I think the reach is extremely important, being able to like really disseminate our research for practices and policy impact. So now I'm going to pass it on to Dr. Bruce, who's going to talk a little bit more about the key principles.
Thank you. So we thought a really fun way to kind of bring these principles to life would be through some stories. Anisha shared a few of her insights from the work that she's done, but we wanted to highlight what we feel are a few key foundational principles when doing community engaged research with community partners. One is alignment with community priorities, so following your community partner's lead. Really thinking about expectations overall for the entire research project, so aligning those expectations. Thinking about funding and making sure that whatever funding is received or sought after, that there's an equitable distribution across partners. Thinking about the research process, how we as researchers from a large institution focused on research can really support the process from the community level. Always putting attention to flexibility. That's incredibly important with partners. And then lastly, as Anisha mentioned, really all of the fun ways you can partner with your community around dissemination. But before I get into one of my stories, I wanted to just open it up to this group here and our group online to just hear from you. How do you engage with community partners to understand or identify their community needs and priorities? Yes.
I don't have but in hospital, we were working with folks who had a path to like a parent advisory committee, and whenever we were designing, we would consult and let them, okay, got it, and get their input whenever we were creating anything new.
Project. Well, that's great. So it sounds like you had a really strong parent advisory group that was able to kind of throughout the process give you a lot of insights into what they cared about, what mattered to them, and the directions for interventions as well. Yeah.
So some of the work I'm involved in is in regards to the genetics of recurrent pregnancy loss. So, social media has actually been a pretty powerful platform for us, and a place to post our study, but also get feedback and comments about what people want, what kind of are the barriers to participating, inclusion, exclusion criteria that you realize in itself can be quite limiting, and a barrier to enrolling in research and just getting clinical care. So, that's been a very high yield way of engaging with the community.
Wonderful. So we've heard of a couple examples of like a small, intimate, very trusted group of advisors, all the way from hearing from large stakeholder groups that can really provide a breadth of different topics and concerns and needs. Anybody in the chat have any? Okay, thank you. Thank you for sharing that. I'm going to share a little story about a collaboration with Life Moves. This was a pediatric resident of ours who had really extensive experience working with the unsheltered population. And she came here to Stanford, wanted to kind of build some new connections with stakeholders and organizations in this area. And this was not a partnership that we had. We reached out to an organization that was originally called the Shelter Network, but is now called Life Moves. And really what we started with was asking and listening, and just sat down with some partners and said, what are you seeing? What are the key issues that are rising for your population? And we tried to spend, like, kind of my ratio is spend like at least 90% of the conversation asking and listening. And then at the end, kind of explore what opportunities there might be to collaborate. So they obviously know we are from Stanford, some of the expertise that we can offer. And interestingly, they said asthma. Asthma was a really big concern that they were seeing for their patient population. They had actually in the recent past, they had multiple calls for emergency services to transport kids that had really severe asthma attacks. And so they were very clear with what their priority was. And the resident at the time, after the meeting, she was just like, I am a pediatrician, but I'll be honest, asthma is not the thing that is super exciting to me. And I loved her honesty. And I said, you know what? I really appreciate that. What we can do is you can decide if you want to just do asthma and support them because that's the need that they've asked for, or we can try to work and see if we can find other support and partnerships that we can develop. And she thought about it and she's like, you know what? No, I want to do the collaboration. And what she did is she did some focus groups with the parents of the kids at the shelter, really hearing more about their needs around asthma. And basically, so many things emerged from that, including kind of the need for smoking cessation support, the need for a better indoor air quality. We had a medical student that came in and did indoor air quality assessments. We had another resident that did focus groups around specific curricula needs for smoking cessation. And years later, Dr. Lisa Chamberlain and I, she's a colleague of mine in our office, we ran into the director of Life Moves, and he came up and he said, I need to tell you the impact that your trainees have had on our work. And we're like, oh gosh, I hope it's good. And he was just like, we have done so much to increase awareness about this issue. We've designed a curriculum, and drum roll, they removed the carpets from every shelter in the entire network. So that's South San Francisco all the way down to Gilroy through this work. And I just feel like it's such a great illustration of how sometimes we come in with our own expectations and needs, but when we let the community drive, the impact can be, as Anisha said, so much greater.
Okay, so now we're doing a little bit more kind of open-ended question to you all, given your expertise and your experiences. So What priorities do you think that your partners would have when you're engaging in a community academic partnership? And I just want to say, like, when we say community partner or community in community engaged research, we mean anybody. It could be a patient, it could be clinicians, it could be nurses. So it is broad definition. It's not just like a community-based organization. So in thinking of your own research projects you're working on even, what do you anticipate could be some important priorities for your partner that you would be partnering with?
I can imagine the impact or like a solution to the problem they might be facing, as opposed to like research or a publication, which might potentially be a priority of the academic partner.
That is a great example. So I do think that a lot of partners want to see action, right? They want to see impact from the research. They don't want to just see the publication. So their idea of what a deliverable might be may be different than ours. You know, to get promoted, we need to have these publications. We may need to have academic presentations, but for them, it could be very different. Anybody else would like to share? Program intervention and sustainability. So again, kind of getting at that whole idea of action. So actually having interventions to address the barriers maybe that you're identifying. So, you know, we're hearing increasingly that folks are studying health disparities and documenting them, but a lot of the patients and the other partners are saying, you know, it's great you're describing this, but we actually want you to help us fix the problem. So that's getting at that comment. Yes, Dr. Russell in the back.
I think one of the priorities that I see when I'm working with patients and their families is wanting to hear the results. And I think we often sort of silo our findings sort of in academic papers, but really how are you disseminating it? How are you engaging the community in evaluating the results and also interpreting them?
So that's great. So just to kind of repeat back what Chris was saying, so really involving the community partners or the patient partners in the dissemination efforts of your research, also thinking about how they can be involved in the evaluation and also thinking about the results, right? They may be able to write your implications and discussion sections a lot better than we can. So that is also a really great example. Anyone else have anything they'd like to share? No? Okay, nothing else on the chat? Okay, great. All right, so I do think, you know, from all the work that we've done collectively, and also the literature supports this, that when you have a document that highlights basically the aligned expectations between the group that you're partnering with and yourself as an academic institution, that is predictive of a stronger partnership. So it is a key principle to any community engaged research efforts to really come together and have this bi-directional discussion like you would anytime you were engaging in a new partnership, even with someone in academics, right? Understand what their goals are, what are their needs, what are their values. It may be not the peer-reviewed publication, might be something else. Also, take some time to really define what are the different team members going to be doing? What are their strengths? What can they bring to the table? For research, it may be like cleaning the data, analyzing the data. For the community partner, it may be recruiting participants, right? Or disseminating the information back to communities or other stakeholders. So getting that definition down and also integrating it into the budget, which we'll get to as well. Another thing that I think is really important in this document is also thinking about the recognition for contributions. So, you know, when we think about writing a peer-reviewed publication, we always think about at the beginning, like, what are the different author roles? It's good to have that discussion at the beginning rather than at the end. Same thing here. Your partner may not care about the peer-reviewed publication, but for some of them, actually, it does help to validate the work they're doing, to see their work in these academic circles. For others, they may want to take the lead on like a policy brief. So just having that discussion of what are the different deliverables and who's contributing to what and what the, you know, authorship order might be in the lead organization's roles. I mentioned the written compact or the partner agreement already here. And then also something to think about is designating a third party to help resolve any conflict conflicts that may occur, because sometimes things do come up in these partnerships where you need someone who's kind of objective to like really kind of weigh in. Another thing I do want to just say from our experience here at Stanford is if you call this agreement a memorandum of understanding, it can take you down this like rabbit hole of legal stuff. So if you call it a partner agreement, you will need an MOU if you're kind of exchanging funding, or there's something where you actually have to have an MOU based on, you know, the grants and contracts folks. But generally speaking, I think if you could call it a partnership agreement, you'll have less challenges. Wouldn't you say, Janine? The other thing I would say is also when you're developing this document, right, it is a living document, so you'll need to go revisit it periodically. It's not going to be just a document that just stays put. So I'd say, you know, periodically re-meeting with your community partners or your patient partners or families to understand if anything has changed. Anybody have any questions? Yes.
What would be an example of a third party?
An example of a third party? Oh, for example, with our community academic partnership, we have a group that is not actually a part of the partnership, but knows enough about our work that we can kind of go to if there's ever any conflict, and they kind of serve as someone who's more objective and can look at it. Sometimes it can be like your division chief, or it could be someone on the community side, right? If you're actually working with community partners, maybe that person, they could help you identify someone too. So you could even have two, one academic and one community potentially. Do you have any thoughts on that, Janine? In terms of third party?
I like the idea of having a community broker if you can.
Yeah, so community broker, Janine says, is critical, as well as an academic one potentially. Any other questions about this concept? Anything on the chat? Nope. Okay. All right. So another key principle is making sure you ensure equitable funding. How many of you have ever put in a grant where you actually put funding in for your partners on a project? Janine has. So this is actually very key, right? Like thinking about the budget is super important in this work, right? Like if you are going to invite a co-investigator to join you on a clinical trial study where they're a site PI, you would probably have a discussion with them about what resources were needed, right? Same thing with the partners. And actually for them to do the work, right, they probably need the compensation maybe even more than we do because they're a nonprofit or they're, you know, a patient advocacy group. And so they live kind of day to day for their funding as we do. So just bringing them into the discussion. And again, it's a bi-directional discussion about what makes sense for the partner and what work they're doing. But definitely thinking about that in the beginning, not just having it be like you make your budget and at the end, whatever's left over goes to like the partner, right? So I think that's extremely important. Also, you could think about using the budget to hire community members so they can actually help you with recruitment, because that will go a long ways. It's much better than having our teams do the recruitment if they can help. Also, you can have the academics lead on certain grants and then community partners lead on others. And then thinking about what you may need for partnered work on their end, like maybe they need interpreters or translation of all the documents into another language. They need funding for childcare to have, you know, community meetings, or maybe they need transportation and parking. So having that discussion about all the little things that could be in the budget. And this gives you an example from our partnered work of the types of funding we've been able to secure. So I work with two groups in the San Joaquin Valley. They're community-based organizations. One more policy partner that's more kind of academic at UC. And what we've done is some of the grants we take the lead on. So like the internal Stanford grants, usually I take the lead on writing those. And then, but we always have the discussion about the budget. We're putting in a grant right now, and we actually just divided it by 4, whatever the amount was. We just said, we're going to divide it by 4, and everybody gets a 4th because we really are partnered. But other grants like No Kid Hungry or Voices for Healthy Kids or Sierra Health Foundation, actually, it's better for the community partner to apply. They have a greater chance. They don't actually accept many applications for academic partners. So it actually works to provide more funding for our partnership to have all of us kind of applying for different grants. And you can recycle language for different grant applications. It just adds to the pot of money. Does anyone have questions about this at all? Yes.
How do you sort of, especially in sort of the non-community based grants, ensure that your community partners are able to sort of provide the documents and also you know, showcase the amazing work that they're doing? I think when you think about like bio sketches and all these other things that are really like very, very academic that many grants require.
Yeah, so I'm moving it to the next slide because that's what I was going to tell you. I was going to say, as the academic partner, you all know, how many of you think it's easy to apply for grants? It's like a nightmare, right? Okay. So imagine if you knew nothing about these big, huge federal grants or these other grants, and all of a sudden someone's asking you, oh, because I'm writing this grant right now with my partners and I need a bio sketch that's 2 pages. They don't even know they're like, what's a bio sketch? I need financial documents from them. I also need letter of support. So you know what I did this morning? I just took a letter of support we already wrote. I updated it. I sent it to all the partners. I said, does this look fine? I'm taking the bio sketches myself and I'm moving them from 4 pages, which they were for another grant application, to 2. I literally do most of the heavy lifting there because it's like, they don't really want to learn the skill. If you have a community partner that wants to go after NIH funding, then maybe it makes sense to like do some capacity building. But my partners that I'm working with right now, that's not like something that they're like interested in, but having that discussion with them too, about what they want to learn. Is this skill set going to help them? But a lot of times I do most of the heavy lifting, like even the scope of work, I will give it a grant. I'll ask them what they want to do for the project. I'll take a first step in trying to draft it for them. And then we send it back to them to have them give feedback. So same with IRB. IRB is super cumbersome, right? If you want to do a really partnered project, you'll have to do what's called a single IRB, which means that you would end up with, there's an outside external IRB, not Stanford, that works with you, and you put in funding before your grant even goes in so that you can actually have a true partnered IRB application. And that is something you have to think about way in advance because it is a significant amount of money. But if you have any little nitpicky detail questions like this, that's what our offices are here for, to help support you through the process as you put in your grant application. Any other questions about that or the other topics, the budget that's come up? No? Okay. Thanks for planting for my next slide. Okay, so now I'm moving it on to Dr. Bruce again.
Yeah, I think Anisha really highlighted a lot of key insights into how you really partner with community organizations or individuals, whomever it might be. And I just wanted to share another story kind of about the importance of flexibility in the design. So we'll assume that you got through all of those big hurdles around writing and receiving grant funding, creating a partnership agreement, and really being aligned with your community partner. And now you're in the position to like really dig into the work and get started. This was a project that one of our colleagues did with Santa Clara County Department of Social Services. And they had a really cool program at the time, which was a prevention program, which child welfare hadn't really been engaged in a lot of prevention. And so they wanted this resident to really understand from families kind of some of their needs and concerns around the programming that had already been implemented. So she did this, and as she was doing a lot of the heavy lifting, they wanted to provide input, as Anisha said, but they just didn't really have the time to like delve into creating the survey instrument guide, but they wanted to provide input. So this resident really took the lead in designing that and in giving feedback to the community partner, or asking for feedback, excuse me. The community partner looked at the demographic survey and was like, you know what, I feel like we have a very a group of parents that may be a little taken back by all of these demographic questions. You've got a whole list here. And our resident was like, very thoughtfully, she said, I looked at the literature, and the literature really shows some potential associations between some of these demographic factors. And, we tried to limit it. But at the end of the day, the resident was just like, your population way better than we do. And we want to be flexible, and we want to do what you think is most accommodating. we don't want to have the type of questions that we theoretically think are important, but are going to be a barrier to participation. Like, how do we know that, had we left some of those questions in there, that when the families actually sat down to do the survey, it could have totally turned them off. And that could have actually, at the end of the day, really impacted our data collection. So the resident, despite, you know, her best intentions and her good understanding of the literature, really wanted to defer to the community. We removed several of the demographic questions, but negotiated leaving a few in, had a very successful survey, but I think it just really highlights that sometimes we come in with such good intentions, such a good handle of the literature and wanting to be able to share that with our partners, but our partners have other needs and motivations for wanting to change the plan. And we have to be really respectful of that to make sure that we have a really thoughtful study that doesn't inhibit participation and gets to what the community partner wants and needs. So that takes us kind of to our last shared principle, and that's the idea of dissemination, collaborative dissemination. And Anisha kind of alluded to a lot of different strategies for dissemination, but I wanted to pause and see if folks here had kind of ideas or ways that they have thought about or seen or actually engaged in terms of dissemination with community partners. Anybody do something cool with their community partner to get the study results out? Oh, yes.
We do a newsletter
Mm-hmm.
that we provide.
Sorry, well, we do a couple things. I think we do birthday cards, which I think is a really nice way to remind them how valued they are. And so we give them a $10 gift card on their birthday. And then also we have a newsletter with the most recent publications. And I think it's a good way to reach out and show people that there's something going on, you know, with the study that they're in. So
Yeah, people get really invested as participants and want to see how their data and how the information that they shared are being used and what came out of it. I was wondering if I could ask you again, how did you decide to do the newsletter versus other forms of dissemination or other products? Did you talk about that with partners, or did you get input from participants ahead of time that they'd like something like that?
that's a good question, because we also have focus groups that we involve our subjects in, both parents and the child participant. And so I think we did get some feedback as to wanting to know results. And since we were in phase 2, that just made sense. But yeah, I think the cards were more of like a team, a kind of brainstorming thing on how to appreciate our subjects.
I love it. I think, you know, using those venues, like when you're kind of towards the end of a focus group, you might say, we want to be able to share these results out. How would you like to receive the information? You know, maybe it might be text, maybe it might be a newsletter, maybe it might be an infographic that Anisha mentioned, or a in-person gathering or presentation, or, you know, whatnot. But it's always great to ask the community what kind of venues they think would be helpful.
And Zoom has shared something else Zoom has shared, Echo newsletter blast, and also shared health fairs.
Oh, health fairs, yes. Somebody on Zoom mentioned echoed the importance of a newsletter, but also mentioned health fairs. I think Anisha and Dongmei and other colleagues have attended a lot of health fairs and use that as a way to get information out. Dongmei, do you want to share kind of how receptive people were at some of the fairs to getting some of the results? And
Yeah, I think our office attend 2 fairs before. One is the Health Matters Stanford in May, and then another one it just happened in the last weekend or this weekend. I almost forgot. Just last weekend, Saturday. I feels like a long time ago. So it's a more at the Patel Community Center. So it's very different audience, and then people actually really interested in like what the Stanford, because Stanford is like known as a research institute, right? Even like other institute people were really interested in like what the research we are doing, and then like what's the result, and then they would like to learn more, and then they like very interesting in like kind of like get involved as well. So I think it's very helpful like if our research team can be out there, and then the community member were able to learn more about your project, and then like support the project. So in a House Matter, we got about like 5 partners to join us, including some of the lab like Dr. Khan's lab and Dr. Charles' lab, and then also like other Tina's lab also there. It's like it's pretty good, like dynamic I can see.
That's great. Yeah, I think that a lot of times I focus on thinking about getting the findings out to participants and my immediate community partners and collaborators, but there's such a power in getting it out to the wider community. And our office has a coalition of community partner organizations that we bring together every other month. And I've heard multiple times by different stakeholders, if you have any data or findings that you want to get out, we're very hungry for the evidence, because they can use it to kind of build kind of impetus for their own work or have further evidence that really supports the work that they're doing.
Can I just add something? Oh, sorry.
Please go ahead.
Oh, I was just going to add that when I mentioned health fairs and newsletter blast, I just wanted to say it wasn't from our group. It was from our community group already has a newsletter and an email list. And so we just asked they asked if we could contribute to that. And so that's what we did. And then their health fair, they were already doing that, and they asked us to come present there. So actually, in this case, they led those forms of engagement.
Oh, great. Thank you for sharing a little bit more about that.
Online
Great.
response. Someone's interested to know if and how the panel uses member checking for validation of qualitative data coding, with the opportunity to adjust or correct if researchers didn't accurately represent the data, as a way to share ownership of the data.
Absolutely. I think Anisha and I have used this example in the past of having those kind of member check discussions. They can be with the actual participants. They can be with like some very key stakeholders that really know the participant group really well. We had some medical students who were working with a whole host of different stakeholders in Santa Clara County around early education. And they specifically wanted to do a member check, but also be able to use it as an opportunity to disseminate kind of the preliminary findings. And it was very interesting. We set up the meeting, and when we went down there, one of the first things that our main community partner said was, I have to be honest, I didn't think you would actually come back. You said that when we first met, that you would be coming back with the results and a report and whatnot. And we wanted to have those data, but we didn't actually think you would do it. So even if we, kind of state those intentions and we have an alignment of expectations, there is some hesitation on the community partner side that we actually won't come back as academic partners, that we will get our data and basically publish it and run. So I think that was a really great point, that you can use it as a research approach to increase the rigor of your findings qualitatively, but it also has a big benefit to the community partners as well. Very quickly, I will just share this one example, just because I love it and it is near and dear to my heart. We had another resident that was working with the Gilroy Unified School District, working with unaccompanied minor youth who come here to work from all over the world, mostly Central and South America, to earn money to send back to their families. But they are children, they are youth, they are here independently. And the Gilroy Unified School District supports them. And so our resident did focus groups to really understand kind of their needs around health. It turned out that they basically have no basic supplies, no eye washes, no Band-Aids, no ointments, virtually nothing as they're going out into the fields doing a very hazardous job. And so, we disseminated the results, gave it back to them. But the one thing that was different is the resident disseminated back a grant that he had written, an internal grant that he had written to create some health kits. And those health kits were disseminated to the youth. But in giving back the grant as a dissemination product, the community partners turned around, resubmitted that same grant for a regional grant that was able to fund and purchase and disseminate health kits to unaccompanied minor youth all across Northern California. So just an example. Anisha has other examples of different dissemination products as well.
So this was the partnership I was just referring to. It's with two organizations in the San Joaquin Valley, and actually Janine has participated in this group as well. So just to give you some ideas of ways to disseminate. So one was a community partner actually wrote an op-ed in the Fresno Bee about the topic. So that was a way to get the information out there to a different audience. They also got some funding from Radio Bilingue to actually hold some sessions on the radio, talking about the rollout of free school meals during the pandemic. So that was another good opportunity for dissemination of some of the work that we were doing. We've also participated in advocacy efforts. So I myself have been asked to they give me a template to tweet. And so I would tweet some information about a specific bill that I feel like there's good evidence to support. Similarly, we also, not Stanford, as individuals, you can sign on to a lot of legislative opportunities. So as groups, they signed on to a letter to support the rollout of universal free meals for all students, regardless of income status here in California, which passed. And then another thing we did was the policy brief, which you can see up at the top, which just kind of got this information out to policymakers, so it'd be kind of reaching policy, legislative activity. And then with regard to the member checking question, actually Janine participated in this too. We had, after we conducted some focus groups and stakeholder interviews, we synthesized all that information, presented it back to the community in the form of 2 webinars. One was for parents who participated, as well as the broader parents in the community, and another was with school officials. So that was a way of also validating those research findings through qualitative, and that got integrated into then the publication, which a lot of times for qualitative methods, they want you to include that description of member checking, which Dr. Bruce gave a presentation on that last week. So you can go to that presentation if you have questions about qualitative research. Okay, so I think we're getting to the end here, and I just wanted to share a few quick resources. But first was other community engaged research partners on campus that you can look towards for additional information. A lot of the departments in the School of Medicine have associate chairs for community engagement and advocacy. So Lisa Chamberlain is the one in our department. There's a similar person in the School of Medicine, I think medicine department, as well as psychiatry. So I think that's emerging. There's also the Department of Pediatrics Office of Child Health Equity. If you all are in the Department of Pediatrics, that's a great resource. Haas Center for Public Service has a lot of great events. Actually, we were just talking about someone here participated in a course from the Haas that was run out of the Haas Center. And there are also some great grant opportunities for students. So they are great service learning partners. The HEAL Network, which is through the School of Medicine, Dr. Bonnie Maldonado helps to lead those efforts. You'll see some presentations from them. The Research Participant Engagement Program, they presented earlier in a presentation last week on increasing diversity in clinical trials. So they're also a good group to reach out to if you want to increase diversity in your clinical trials. Stanford Cancer Institute, Stanford Impact Labs, funding organizations. And then also there's the School of Medicine Office of Community Engagement, which we work with regularly, as well as the university-wide community engagement office. And Dom May actually has pulled together all the resources. She interviewed a bunch of key stakeholders on campus. So on the MCHRI website, there's a list of all these offices and what services they provide. In case you want to learn more, you can go to the website. Funding sources I've listed here. I wanted to just give a shout out. We have some grants right now through MCHRI that are focused on community engaged research, up to $50,000 for faculty. And then if you have fellow applicants, it's up to $5,000 for those grants, and those are due October 16th, I believe. Stanford Impact Labs also has a grant open right now focused on community partnered solutions in research. The Stanford Office of Community Engagement at the university level also has a grant available right now. So those are 3 funding opportunities right now, and they are pretty much occurring on a regular basis. So they're annual or biannual. And then if you have specific questions about community engaged research, MCHRI can help you if you're working with maternal and child health research kind of populations. Otherwise, we have other partners who serve other groups on campus, but there's a technical assistance request you can put in your information and we will meet with you. And then last year for the symposium, we had a focus on community engaged research. Those presentations are all actually available online. If you want to learn more, you can go to those recorded presentations, but they were from MCHRI, which is a national funding organization, and as well as NIMHD at NIH, and also RWJ. And then Nina Wallerstein is one of the experts in community engaged research as well. And Cincy Hernandez has done a lot of work in this space. So those were really excellent presentations if you want to learn more. All right, I think that is it. And do you want to take a few minutes to discuss anything, Janine?
Sure. There was a question in the chat, Anisha, about when engaging in conversations with pediatric populations, do you include parents in the dialogue? How do you assess and balance the input provided by children versus those of adults?
Yeah, so does anybody else want to answer that question? Otherwise, I can take a stab, and then Janine could also add in. So a lot of times, one way to get feedback, in addition to partnering fully with an organization, which hopefully will be able to obtain the input from some of these groups, is to actually form an advisory board. And many studies actually have, you could have a mixed advisory board, which includes community organizations or key stakeholders that you think are essential to your research topic, which includes not only parents, but other stakeholders as well. However, sometimes there can be a power differential, right, like between groups. So in those cases, you could also have a separate community advisory board that includes just parents. Same thing with youth, right? Depending on their age, they may or may not be able to participate in those other mixed cabs. It really just depends on the groups you're working with and their comfort level. However, if you want to have a mixed cab, it's usually good to have more than one of that type of participant. So instead of having just one parent having 2 or 3, or instead of having just one, youth having multiple youth, so that they don't feel like they're isolated in that, venue. And then you get, at a certain point, you get too large of a cab. But this has come up. So we want to have another discussion on kind of cabs and key principles of developing these advisory boards, because that came up in the last presentation as something I wanted to learn more about.
Allison, who is online with us, Allison is from the Lucille Packard Foundation for Children's Health, so our foundation arm. You mentioned some great resources in the chat. Wanted to know if you wanted to unmute and share those with the group.
Yeah, hi. I would just add that both of those resources do require you to share your information, and then they send it to you, because that's how they track downloads and who's using the resources. The other thing I would add, if you're not familiar with the Children Youth with Special Healthcare Needs National Research Network, it is a network funded by the Maternal and Child Health Bureau, and Stanford is part of the network. Historically, Lee Sanders has been the main person involved. I'm not sure who currently involved from Stanford, but they're both very relevant to the conversations today, and I do recommend checking them out.
Great, thank you for sharing those resources.
Allison, we'll be in touch, and we can try to get that information from you and send it out to the participants of this call and our wider CNR listserv, which we put together. So.
Sure.
So Anisha and I only had a chance to cover a few of some of the important principles. Wanted to hear from those online and hear if there are other things you've learned kind of in your work that you wanted to highlight and share with the group.
There is another question in the Zoom chat just asking related to PEDS. Do you find that PEDS patients are more likely to share and be vulnerable if their caregiver is involved in the dialogue?
I don't actually have any experience having kind of a shared conversation and dialogue. I think it also depends on the age of the child, which Anisha alluded to. But depending on the age, when you have a younger child, I think it would be advisable to have a parent at least nearby. Maybe not actively in the conversation, but nearby. But I think the challenge really with younger patients or kids is their kind of reticence to speak. And so you may need to employ other ways to kind of hear from them, like ask them to draw a picture, ask them to, show things to you or look at pictures or have other things that are going to prompt conversations.
Yeah, I've only had like a couple examples, but for one project we're working on, we have parent-child dyad kind of involvement. So it's focused on school meals. We wanted to hear the perspectives of children of a certain age group, but we're employing the parents as a way to kind of get the information with the kiddo at the same time. So that could be a good strategy employ with younger children, as Janine mentioned. But the older youth, a lot of times they don't want to be with their parents, so they're okay being by themselves with us.
Great. Any other questions or thoughts? Yes.
I think it's on. I was curious to know what happens in the case where the findings of your study aren't favorable, or they're maybe not what the community partner wants to find, or they're inconclusive, or you find that it's too early in the stage to actually lead to effective translation within the community. What happens in that case, and how do you manage the relationship in the long term to make sure that that community partner or whoever you advised continues to be receptive to research and engage with other opportunities or with your own group in the future?
No, I think that's a really, really great question. And oftentimes when you're designing the questions or getting input alongside the community, they can kind of anticipate what could come out in the discussions, particularly if you're evaluating an intervention or perceptions of an organization and you want to get, parent perspectives or participant perspectives on that, there could be some negative findings. And we've actually had that only happen a couple of times and really wanted to we worked very closely with the community partner organization to figure out what and how they wanted to kind of think about those data. It was for them to use. The data is theirs. It's not ours. We're not going to disseminate or process anything without their input. So it gave them a lot of opportunities to think about programmatically things that they wanted to change. But then in terms of any dissemination that we did, like a shared manuscript or a white paper or whatever it might be, we worked with them to figure out what was relevant, because sometimes, programmatic feedback isn't necessarily the story that you as an academic partner or they as a community partner are hoping to tell to the wider audience, but that information can be really used internally to make a lot of improvements and changes.
And I do think it's a long-term partnership, hopefully, that you're engaging with. So even those null findings, especially if you pair them with qualitative, a lot of times you can understand like the context by which you may have had the findings that weren't anticipated, or what are the next steps for building on the work, right? The prior work. So, even in our partnership, we've had one initial study, which led to a second study, which led to a third study, because you found something that needed to be addressed that wasn't fully being addressed by the initial study. So you just keep kind of building on the work over time. Does anyone else have any good examples from their own work, how that's happened with their groups?
Great. Any last questions online? All right. Well, thank you so much for coming today. We are very open to feedback or questions after the session. You can reach out to Anisha, myself, or Dong Mei. We just would love to have an open conversation if there are other thoughts that you have.
Thank you, everyone.
Thank you.